I just want to ask you, I'm the alternative medicine guy. And so when patients come to me, they know I'm going to look at all their non-drug options and exercise and nutrition and supplements and acupuncture and osteopathic treatment and all those things. But I'm going to ask you, when you go to the regular doctor, the MD or DO that you see who does regular medicine, what do you expect? I want to show you something. This is the Journal of Family Practice. One more quick look. I read it and I was kind of stunned by how clear it is, what it says and what it should cause you to expect. I know you don't get this magazine unless you're a doctor, and you don't want it. Really, you don't, because this talks about what most doctors are involved in every day. This talks about, is your patient taking too many pills? Yes. It's almost a lock. Yes, your patient's taking too many pills. And that's because when a doctor looks at a patient, a doctor who's conventionally trained in Western medicine, the question that comes to mind is, what medication will help this patient do better? That's their job. That's what doctors do. And to say to a doctor, now I expect you to look at me holistically and globally in terms of nutrition and exercise and supplements and all that, that's probably a reach for most doctors. That's coming. But my question to you is, if you're going to see a doctor, be prepared for that. Here's the other headline I thought was so interesting. Which drugs for diabetic neuropathy? In other words, for diabetics who have nerve pain, which drugs? So the question that doctors are asking is, which drug do I use to treat this patient? Now for me, if a patient has a nerve problem from diabetes, I'll give them alpha lipoic acid, which I love. I have a YouTube video on that that's been around forever. 300 milligrams 3 times a day. It can make a huge difference, but it's not a drug. It doesn't have the toxicity of a drug. It detoxifies the liver, it clears up the nerves. But when I think about it, my thought is not which drug. I know which drug, I know about Lyrica, I know about the drugs that work, and they're useful. But you don't want to think that you're going to go to your doctor and your doctor is going to say, let me think about what nutritional plan I'm going to put you on. That's your job. I can help you with that. We have lots of resources. You can use the net and you can ask Dr. Google about supplements for a specific problem and you get some help. Then get with your doctor knowing that his focus is going to be which medications are going to help you. That's his job. You can help him do his job for you better. If you're interested in supplements and nutrition and exercise, you can help your doctor, but don't expect him to run that whole show. That's your job and you can do it. There's tons of resources to do it well. Get with your doctor about this and all the stuff you're interested in, because if you know exactly what you want, you can get it, and we're better together.